Hello, and welcome to the Caregiver Child Connection Program. My name is Minerva Villarreal. I am the Foundation Program Coordinator with the Wilma Charitable Foundation. And today we are covering how illness affects others. And it is going to be given by Lucy Barylak and Elliot Montgomery Sklar. A little bit about Elliot. Dr. Elliot Montgomery Sklar is a public health professional with 2 decades of experience in supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and caregivers in Canada, Florida, and virtually. Dr. Sklar is a professor of health science at Nova Southern University in Florida. He publishes and presents his work internationally, focused on the complexity of issues related to aging and caregiving. Now, Lucy Barylak received her master's degree in social work from McGill University and has dedicated her career to supporting caregivers. Lucy was the founder and longstanding manager of the Caregiver Support Center at the CLSC Renee Casson multi-service respite program for family caregivers and oversaw transference of knowledge for programs including caregiving, mental health, elder abuse, and palliative care. In 2003 and 2012, she received the Queen's Jubilee Award presented by the Canadian Home Care Association and awarded on the basis of her dedication in developing a national coalition to support the issues and challenges facing informal caregivers. Ms. Barylak also co-edited a book in caregiving issues titled Responding Creatively to the Needs of Caregivers, a resource for healthcare professionals, published by Edition St. Martin in 2002. In 2018, she was authored to a chapter in Marguerite Blais, Minister of Seniors in Quebec, and Rosette Pepper's book, De la Proche. I am not even going to try to, to say that one. Uh, Published by Marcel Broquet in 2018. She has been a key architect in screening and assessment tools for family caregivers, and she provides training for healthcare professionals across North America on the use of these tools. Lucy is also a consultant for private industry, which includes work with the Wilma Charitable Foundation and clinics in Texas. Lucy is also a liaison supervisor of the social work at McGill University. Take it away, guys.
Thanks so much. Thank you very much, Minerva, and welcome to our participants today as well. I also want to welcome back Glenda. For those of you who are familiar with Glenda, she is going to be our moderator in addition to Minerva for our program today. So welcome again. You know, sometimes people say that when one family member gets sick, the whole family is sick. And that can be taken in many different ways. For example, I think with my public health hat on, if a family member has the flu or COVID, there are other things in the home that can be done to prevent getting the flu or COVID as much as possible, like not sharing the same bathroom or keeping that sick person isolated in a well-ventilated room as much as possible. Now, in other cases, that might mean that caregiving can be demanding and it requires that you care for yourself so that you don't get sick. That's again a very practical thing, especially at this time of the year. But for some other people, it might mean how a family member's illness or diagnosis of illness affects those around that person, both in terms of caregiving, but also how illness can change things in our relationships, intimacy, sharing of responsibilities, and household tasks. Those are impacts and experiences that are not necessarily universal, and not everyone experiences the impact of a family member's illness in the same way. And so our image here of water was very deliberate because for some people, when there is a diagnosis of an illness, you can feel underwater, like things are just completely beyond your control.
Thank you for that, Elliot. Yeah, a person's quality of life tends to be similar to those around them. When someone you love develops a serious illness, the negative impact on the patient's life can also influence the rest of the family's well-being. While it's crucial that family members support their sick loved one, it's equally important to be aware of the obstacles that illness can impose on the whole family. By understanding the challenges that may arise, your family will be better prepared to work through and support your sick loved one, as best as you can in kind of a united way. When a family member is sick, it can have a significant impact on the rest of the family dynamics, and that's what I want to speak about, and their well-being. The specific effects can vary depending on the nature and severity of the illness, the family existing dynamics, and their coping mechanism, will really play a big role of how everybody is able to handle this. So let's look at what kind of problems do family members face when a loved one becomes ill. If you have a sick loved one, here are some challenges your family may need to work through. And that, not all of them are the same. Every family is an individual, but there could be emotional challenges. Watching someone you love struggle with illness is painful, making many family members feel a sense of helplessness or loss of control. Emotions impact each person to different extents, but it's normal to feel any of the following emotions. Sometimes you feel guilty, like, why them, not me? Can be very angry, and it's normal. And there's definitely fear and uncertainty of, especially if someone is diagnosed with a progressive illness, what's going to happen. And what is very important is to acknowledge your feelings. By doing that, it's really the first step in dealing and recognizing what you're faced with. I want to tell you that Elliot and I talk in more detail about each of these emotions and many more in a series we call a series of emotions. You can find them on the WellMed website. And Minerva can let you know later on how to even get on that.
We actually also have it right here on this slide. It's
Oh,
hyperlinked.
thank you.
So in our handout with this presentation, you can just click on this and it will link to it automatically.
That's easy. Thank you for that, Elliot. Emotional challenges can include communication challenges. For example, the stress of a situation can lead to misunderstandings and conflicts among family members. And some family members may find it difficult to talk openly about the illness or their emotions, or may want to keep things private and within the family unit, like, let's not tell anybody about what's going on, which can create a sense of isolation for family members and caregivers. So let's look at some of the other things that could affect the family. Functional changes. For example, each family member fills certain roles in their household, allowing family to function sometimes like clockwork. Well, maybe not like clockwork in general. Sometimes we all go to bed with a sink full of dishes or forget to pay a bill, okay? But when one family member becomes too ill to function, it can feel like the family structure has gone completely off the rails. Okay. The rest of the family feels pressure to fill the roles of the patient, and trying to absorb other people's responsibility can really feel overwhelming. And it's something that you really need to stop and kind of think about, really, what's going on here? Why is everything topsy-turvy? The other thing to look at is also that there's physical changes, driving your family member to medical appointments, preparing special meals, picking up prescriptions, and being too stressed to sleep can make you feel like your body's tank is constantly running on empty. Neglecting your own appointments, feeling exhausted, developing body aches are common symptoms of caregiving stress, or problems even with digestion. So you need to be aware if something new is going on, it could very well be because of all these things that have changed in the family dynamics. Excuse me. Now, there's also definitely can be relationship changes. Each family member deals with a variety of complex emotions, and it can be hard for them to understand one another. Some may feel anger for being burdened with most of the caregiving, while others might feel neglected as the patient gets most of the family attention. And this really does happen in families. Poor communication can cause tension and arguments between family members. In turn, strained relationships make it harder for the patient to remain positive and helpful as they cope with their illness. So really the whole idea behind all of this is to step back and to just say, what's going on here? Now, there could be professional changes. So, what do I mean by that? A person's illness can be very disruptive to their family's professional and academic lives. If dad is in the hospital, he can't help his kids with, let's say, their math homework because he used to do the homework with the kids. If mom has to drop everything to respond to grandma's health emergencies, she may miss important meetings or deadlines. So when caregiving responsibilities are demanding and coping with with an ill family member is challenging, it's hard to be able to focus on work or focus on things at all. So that's something to keep in mind. Now, there's another one that's really very important, which is the financial implications of a family's illness often presents a tremendous burden. If the patient was normally the family main breadwinner, the rest of the family has to quickly adjust to life without their regular income. If the patient is a child, one or more parents may need to take a leave from work, and disability income is often less than their standard pay. And with the high cost of living nowadays, it's a double whammy. So costs of treatments, transportation, medication, and hiring, if you need to, private help can quickly mount into unmanageable expenses, adding to the family stress. And we know that when financials come in play, it really disrupts the family even more. So having said all this, I know that we don't have as many people on the line, but the one person, if is it something that's resonating with you? And we want to give you an opportunity to ask any questions that you would like. Well, just in a personal sharing with you is that I know that when my mom got really sick and I'm an only child and all of a sudden had to be the caregiver, it really disrupted the family dynamics in certain ways. For example, we used to sometimes, want to go for a drive in the weekend or go somewhere or even go to visit family, friends and for dinner. And I was apprehensive to do that because I was scared of leaving her at that time or not knowing exactly what to do. So that created tensions within the family with my husband and even with the kids, because we weren't able to do as much as we used to do with the children when mom was well.
Yep, it reminds me of a term that we used to talk about a lot, the sandwich generation. But there are still sandwich generations. We just don't use that terminology as much, and it can be very stressful to be a caregiver for a child and also for a parent. So there are added stresses and complexities. And this concept of when one family member is sick, the whole family is sick is something that was discussed when I used to teach in medical school. In the very few instances when we would talk about implications of someone's illness or caregiver issues. And I think it's so important that we don't think of that as a blanket because it depends on so many different things. Lucy, you brought up a lot of excellent and very practical points in distinguishing different categories of challenges for caregivers. But not everyone's experience is the same. And some families demonstrate amazing resilience and support for one another during difficult times. And I think a lot of that has to do with how you and your family have coped with good and bad things in the past, and also how those interpersonal dynamics within the family unit come into play, as you were saying, Lucy. And it also depends on what the health issue is. Not everything is the same. nor the prognosis, and the caregiving needs that that person might have, as well as what the history of the relationship might have been within the family unit factors in. Also, something that we don't think about is the ages of the people in the family unit or the age of the person who is sick. There are generational differences in how we view caregiving. And that is also I guess, tied together with someone's caregiving role or their illness. And I wanted to share personally, when I was 19, my mom had been diagnosed with breast cancer. And a therapist at the time had told me, and I remember that from that time too, that when one family member is sick, everyone in the family is sick. And that didn't sit well with me at the time. As a young person, I didn't want to feel like I was sick and that my mother didn't want us thinking of our family unit as being sick either. That wasn't for her helpful to her healing. My mom was at the time 49, and I had a brother who was 10. And the illusion of normalcy was our family's way of coping. But that front of normalcy really did an injustice to the fears and experiences I think that each of us were going through. I didn't want to saddle my mother, whom I was closest to, with my fears and my concerns. And my friends at the time were in college and partying and dating. No one wanted to talk about cancer. I had a final exam, ironically, in abnormal psychology the day after my mother's lumpectomy. And my average in that class to that point was 84 out of 100. And I got a 48 on that exam. And I spoke with my professor, who was herself a clinical psychologist in private practice as well, to ask if there was anything under the circumstances that I could do to improve my grade or retake the final. I shared with her what I was going through, and I had brought my mother's discharge papers from the hospital. And she thought it over, and she told me that it would not have been fair to the other students to accommodate my circumstances. And I was so upset. I remember how isolated I felt in that experience. And one of the common experiences of family caregivers is isolation. And isolation can be felt, certainly even when you're around others. It's, in fact, a very commonly reported experience of younger caregivers. And I'm talking about Gen Z and millennial caregivers, groups that we really don't talk enough about. So when someone in the family is sick and you have a young person in the family, it can be very isolating for them because of that age. If you think about it, as we get older, we talk about our aches and pains, and chronic health issues become more commonplace, but not when you're young. So with that said, I wanted to talk a little bit about these younger caregivers because it's very important for many reasons. Of the 40 million or so caregivers in the US, 1 in 4 are millennials. So millennials are aged between their late 20s and early 40s right now. But the national data that we have about millennial caregiver experiences are very limited. Millennials tend to be more often single, never having been married, and also have lower household incomes than older generations of caregivers. They report caring for someone with long-term physical conditions, but also, and this is something we didn't have in the past, caring for someone with emotional or mental health issues. Now, millennials have less siblings on average to help in providing care to aging parents as well. And many baby boomers, their parents, are divorced and single, leaving caregiving to children rather than to a spouse necessarily. So interestingly, millennial caregivers are more likely than older caregivers to be men, according to a study from the Center for Public Affairs Research. And the US Census data also reports that for millennials born between 1980 and 84, 90% of them moved away from home by the age of 27. And after that, about 50% of them moved back home. So that still leaves 45% of those 1 in 4 millennial caregivers living away from family. So when someone in the family is sick, that might create a real issue for someone who may have to, for example, travel back and forth to take care of someone, or who may be unfamiliar at this point with what resources might exist in their hometown to look after them, or their family might have moved somewhere else. So these changes in family structure can affect family dynamics, especially as it relates to caregiving. And for all of these reasons, millennial caregivers, as I was saying, often feel more isolation when someone is sick. Now, I think intergenerational friendships are really important for millennials. Think about colleagues, think about other people in your life, friends of your parents, as an example. I think there's a lot to learn from older people who have more life experience, especially when it comes to potentially caregiver issues or dealing with illness. And we can find support in different places. We know not all work situations have caregiver support groups, but it can be surprising how much support from colleagues, from a religious community or other community groups, and even, as I was saying, your parents' friends, can make a huge difference. And as an example, we often grew up knowing some of our parents' friends. And if you had a good rapport with them, it could be good to reconnect, even if those friends of your parents are still in contact. They could potentially offer some suggestions or insights that could be helpful. So I thought that those were important things to highlight for our millennial caregivers. But I was curious, and I know, again, we don't have a large group today, but I wanted to know if you had any thoughts. Do you think that generational differences or age plays into the experience of caregiving dynamics in the family? If you have any thoughts, you can certainly enter it into the chat, or feel free to unmute.
Well, I do have a comment with if the person is kind of thinking about it. You know, it's interesting because we decided to do a bit of a study in high school, very non-scientific study, to see if any high school kids were actually going through caregiving issues. And so we had a young social worker go into the schools and sort of talk about caregiving, very much about younger caregiving. And at the end of the session, student had an opportunity to come and talk in private. And it was interesting. There weren't many, but the few that did come up said that they were always labeled as being late for school, not attending school, disruptive, not, keeping to themselves. And they were the ones that were able to say, I'm always late at school because I have to make sure that my mom or whoever was they were caring for had something to eat, or I had to go and get some food because nothing was in the fridge. So it's just interesting that I think schools should really pay attention and ask the right questions when someone is displaying any signs of what they think are truancy or not really wanting to be in school.
Those are excellent points. 2 weeks from today, actually, I'm going to be giving a talk at the American Public Health Association on men and caregiving, because this is a group that lacks a lot of support and resources, which we talk about in our programs. But as part of that panel, I'm going to be joined with 3 other researchers, all of whom are doing very interesting work in different domains of caregiving. Because as we know, we don't have new data since the pandemic, and a lot of different people have become caregivers as a result of COVID, either because people have passed away who assumed caregiving roles, or because also many people are dealing with long COVID. About 10% of people who've had COVID have long COVID symptoms, which can include fatigue, or breathing issues, a variety of things that might require care. So there are all kinds of different pockets of people who are new to the caregiving world, who never thought that this would be something they would be responsible for at certain points. And I'm looking forward to learning from others what some of this new research is saying, because it's not even published yet. So we have a lot to do.
It would be very interesting. And, I was also thinking, Elliot, Are there specific resources to support younger caregivers in the United States?
Well, funny you should ask, because we have a slide about that. Um, yes, there are, but not enough. I'm a university professor and previously a university administrator. Um, Universities have some dedicated support for caregivers. About 11% of university students are also family caregivers, but oddly enough, maybe, oddly, maybe not, that's saying the shoemaker with no shoes. Universities are slow in making progress on this front. There are really only a handful of universities that I know of that have specific supports and programs for caregivers. And of the ones that do, it's usually geared toward children, which is not the reality of many students. I think one of the upsides to the pandemic, perhaps, was our transition to connecting online with others. So there are a lot of support groups online and a lot of information. Unfortunately, as we know, younger caregivers grew up with the internet, so they're a little bit more nimble. And I think that's also why there are more support groups for younger caregivers online. If you are looking for something local, though, local to wherever you might be, it does vary considerably. And so we always suggest looking online. 211 is an amazing local resource. And again, we always want to emphasize that if you're in a crisis, remember that you can always call 988 and speak with a mental health counselor, completely free and anonymous. So for our millennial caregivers out there, I do want to encourage people to talk about their experiences. It's very important because that's how we learn from others, and it's also quite healing. Many people say that they find sharing their experiences to really help them. There are online communities like 7 Cups, and that is the world's largest online support network. Many caregivers have created their own hubs or little networks within 7 Cups, including groups for younger caregivers. And there are also disease-specific support groups for younger caregivers. For example, the Alzheimer's Association does have online groups for younger caregivers, and often cancer care support groups will focus on younger people as well, or have different age groups that they focus upon. So the type of illness definitely has implications for what type of supports are available. And as I said, common things like Alzheimer's, stroke, Parkinson's, cancer, they will have more support groups typically for more diverse caregivers.
Well, thank you for that. One thing that is also important to keep in mind is the type of illness is also a factor, right? So I want to talk about mental illness. It's quite prevalent, but not all of the people who are mentally ill have been diagnosed or are receiving treatment for the condition. So whether or not a person has been diagnosed with a condition such as major depression disorder, bipolar disorder, schizophrenia, or any form of mental illness, their condition affects their loved ones in many ways. Okay? It's important to keep that in mind. Mental illness is often characterized by mood swings and unpredictable behavior. Family members may feel a wide range of emotions, from resentment to anger to shame. At times, family members may feel that they're so focused on the mental illness that they're unable to focus on their own lives. Everyone in the family is likely to be affected by one member's symptom of mental illness, which can vary from stable to severe. Excuse me. For example, the spouse of a mentally ill individual may feel confused or angry at unpredictable behavior. So it's normal. You don't know how to deal with it. 1 minute they're behaving a certain way, the next minute they're not. People in the family are likely to have an emotional reaction to the behaviors of the person who suffers from mental illness. But mental illness is still stigmatized in our society. The result is often that people who need help are reluctant to try and get it. They're embarrassed, they're afraid, they're afraid they might lose their job, whatever the reason. All members of the family need to work towards acceptance of the mental illness and overcoming the sense of shame and stigma that may go with it. So what they're, what they actually are saying is that if someone has a mental illness, the first thing you need to do is be able to accept it as an illness, like any other illness. When a person is mentally ill, having support from most of all is members of the family can make a big difference in their ability to get better. Family members may be able to help by offering non-judgmental attitude and by attending family therapy. That is extremely helpful. As well, family members can encourage their loved one to strive for independence, to take medication as prescribed, and to show up for appointments. Each family member needs also to take care of his or hers or their own needs in order to reduce negative feelings such as resentment or feeling overwhelmed. Mental illness is a biological disease and it's treatable, okay? And that's why it's sort of associated with stigma because, well, get over it. It's, you have no control it, but it is a part of it's a brain and it's like any other organ in your body. The more family members take the time to learn about mental illness while still taking care of themselves, more they're able to offer support that their loved one needs. And, that's a lot. A mental illness is extremely difficult. I just want to say that even if you're a family member and you're really willing to support and be not judgmental, it's up to the person if they're even allowing you, like, for example, to go to to the psychiatrist or a doctor or to share information with you. You can't it's just not that easy. So those are also some of the restrictions that family members face when the person doesn't want to share or, for example, doesn't want to take their medications. It's not an easy task.
No, and it's something very important that we discuss. We talk a lot about how common depression is among seniors and how it is overlooked. Suicide risk is highest among white men 65 and older. And it is just very important that we're a little bit more aware of how people are feeling and, that also depression, mental illness can be second to other things. If you get a diagnosis of a chronic illness or are going through treatment for something, that can also lend to not having the best mental health at a given time as well. So we did want to, again, understanding that we don't have a huge group today, but wanted to ask if someone in your life is sick or has been sick and how that has affected you. I've certainly shared my own experience from a younger time in my life. I think all of us at some point have been affected by someone in our home or in our life being sick. Like I said, it could even have been COVID, but to varying degrees, I think we've all been impacted at some point. So any comments, again, you can enter in the chat. But I think this is especially true for caregivers whose loved ones have dementia or Alzheimer's. And we know that this is a large majority of our caregivers out there. But the disease can really affect the family and person around them because the disease changes our relationship and our ability to have a relationship in the same way. So a spouse may feel like they have lost their partner and the intimacy as well that they've shared. Not having that is a huge void for a caregiver. A child may feel overwhelmed if a parent no longer remembers who they are. And for all the reasons and challenges that we've talked about, functional, economic, and certainly emotional. Another common experience for people caring for someone who is ill as well is that it was not planned for. That seems basic, but illness can really take us by surprise, which can be very hard if we haven't planned, prepared, we don't have savings. And many of us never anticipate having to take on that type of a role. So these are all things that I think are important for us to consider when we talk about family caregiving and how illness affects others, certainly.
For sure. And we want to share an email that we received from a caregiver. It's interesting because, we always say a loved one, but it doesn't always have to be a loved one, and I'll read it to you and we'll talk a little bit more about it. I'm a caregiver for my parents who are in their early 90s. My father has advanced Alzheimer's disease and my mother has many health issues. I've never had a very good relationship with either of my parents. My father was an alcoholic and my mother has always been very focused on herself. So, in having to care for them, I recognize how much anger I have and still do. My sister and I are not close, and she lives across the country. So everything is on my shoulders. I feel resentment towards her. I don't think it's fair how much my life has been impacted by caregiving for my parents, shopping for them, taking care of them, taking them to appointments, watching my dad while I work from home because they don't like having aides in the home. This has really taken a toll on me, but I don't feel like I have another choice or option. What advice do you have for me? So, as I was saying, there are many caregivers who are caring for someone because they feel that they don't have a choice, but that they had a terrible relationship with. And I've encountered, for example, caregivers, especially in a marriage or a partnership, where the person was really quite abusive to the other person. And now they're faced with that. And sometimes there's children that weren't even aware that that the couple had all these problems and sort of insist that mom or dad take care. And so the guilt is put on. So for the person who sent this letter, I can certainly understand how you are feeling. And I'm glad that you can express yourself and be honest with yourself about how you're feeling. It must be very hard to care for your parents under these circumstances. And so really, because I don't have all the information, whether you say that you watch your father when you're at home, so I'm not sure if you're living with them or not living with them. So there's many factors, but what I can say is the first thing you need to do is to get help for yourself. Okay, there are counseling services available, whether it's private or public. You need to have the time to talk about your feelings and your experience in the past. And the other thing that I also want to tell you, there's always a choice in life, and you can express and explore those choices with a counselor. You don't need to do this alone. And but the other thing is there are 3 people in this relationship, and you're one of them. Your needs are as important as your parents' needs are. So if you continue as you are, your mental and physical well-being is at risk. And I am concerned for you at this point. So please go and get the support and help that you need and start working on that. The first step is acknowledging what you told us, your feelings, and the next step is to go and get the support and help that you need in order to make the right decisions in your life. I don't know, Elliot, if there's anything that you would like to add.
Excellent advice on all points. I noticed in the question that the person said that they work from home. One thing I wanted to mention is that at most places, if you are a full-time employee and you do have benefits, one of them is called EAP, Employee Assistance. And usually that will provide 6 counseling sessions that are completely at no cost, no copay. And that those 6 sessions are brief and very goal oriented. So perfect fit for helping to navigate the situation and looking at what those options or choices might be, as you said, Lucy.
Yes, because anger plays a big role in all of this, and we don't want that to escalate or isolate. So I hope that you do reach out. You know, we have a few other tips that we'd like to share with you. I'm just looking at the time. Okay, we certainly have the time. I think it's so important that once the person has been identified that they have an illness, to educate yourself. Learn about the illness, the treatment, the options, and the specific needs of the sick family member. You know, knowledge empowers you to make informed decisions and provides better care. And to know what the potential anticipation is, what, you know, when we say, and what's going to happen in the future. The other thing is to really communicate openly, maintain open and honest communication with the person who is sick, if they're capable to do that, if they're not have a progressed dementia, obviously. Understand their wishes and preferences regarding their care and treatment. Express yours too, if you can. Even go as far as, you know, being honest about setting boundaries, what you can do, what you cannot do, what you're comfortable with, what you're not comfortable with. And as I said to the person who wrote in, seek professional guidance, consult with healthcare professionals to understand and the treatment plan, potential side effects, and any necessary lifetime changes. You know, for example, keep medical appointments and follow the prescribed treatment regimen, get professional counseling if you need it. It can also be helpful for families to work through a diagnosis of what treatment or caregiving looks like, and how to share feelings and responsibilities, especially if there's other members in the family, to be able to do that and to share responsibilities. Okay, it's really important that if you find yourself to be the main caregiver, and for whatever reason, and you cannot cope, it's time to sit down with family and really look at who does what. So organize support, enlist the help of other, as I said, family members or friends to share caregiving responsibilities. This really can prevent you from burning out. And again, set realistic expectations, recognize your own limits and set realistic ways for you to be able to cope and to continue. Now, the other thing is stay flexible. Be prepared for unexpected changes in the health status of the person you know, especially if you educated yourself about what the disease process is all about. Flexibility is your approach, can help you adapt to evolving needs. I mean, it's a journey, so be prepared. You know, remember that being a caregiver can be emotionally and physically demanding. It's essential to reach out for help when needed and take time to care for your own well-being by provided, you know, you need to provide compassionate and effective care towards the person who is sick, but towards yourself as well, so that the quality of their life is a better quality of life for the sick person, but as well as maintaining your quality of life, both physically and mentally.
A lot of good stuff there. We also have a lot of resources to share with our program today. We will be sending all of these out, as we always do. But anytime you see anything that's underlined, it is a hyperlink, so you can click on that and go directly to the resource. We've divided it up into health resources, health hotlines, and also obviously caregiver support and information. So we hope that these resources will be helpful.
They're always helpful. Thank you for that. And that's Elliot's job. Care of all of that. And it is very, very helpful. I just want to sort of, before I pass it on to Glenda, just if any of you are caregiving for someone that you really did not have a good relationship with, all the things that we've talked about caregiving in general is exaggerated even more for you. Even though caregivers go through stress and feel all these feelings, when you're caring for someone for whatever reason, whether it's forced upon you because the children expect you to do it, or what will people say, or it could be for financial reasons that you're staying with that person because financially otherwise you'd be in a very difficult situation. keep that in mind. Please, please take care of yourself and go and get the help. And as I said before, there are always choices in life. There's never just one path to take.
And one last thing, I mentioned employee assistance programs. They're not on the resource list here because they do vary depending on where you work. But for people who do work full-time and have benefits, it's a wonderful thing to look into. Again, because I said there are counselors through your employee assistance program who will set up 6 sessions with you. It can be done virtually, which is great for caregivers who don't have available respite. And there's just no copay. It's completely free and it's goal-oriented. So that's very helpful when it comes to caregiving and trying to find options, solutions, and help to plan.
Well, thank you so much, Lucy and Elliot. Wonderful presentation. I always love the resources too that you provide. And as Elliot said and Lucy said, these will come out to you in a follow-up email. And the hyperlinks will be ready for you to click on to get to all of those resources. That should come out in a couple of days. And along with that will come a survey for you. And we'd love to know what you thought about the session today. Please take them, I'd say 3 or 4 minutes that it will take to complete that survey and return it. Also, if you have any ideas about caregiver teleconnection sessions, topics, presenters that you know of, please let us know about that also in that survey. We would always like to provide you with what you need, and we can't know what that is unless you tell us, so please do that. Let me tell you what's coming up on the Caregiver Teleconnection. Next Tuesday, November the 7th, Elliot and Lucy will be back with you, and they will be talking about the topic that we need so much this time of year, planning for the holidays. That's at 10 o'clock on Tuesday, November the 7th, so please join us for that. And then the afternoon, I will be back with you at 1 o'clock on Tuesday, November the 7th, with Dr. Tam Cummings, and she's going to be doing one of her Ask Dr. Tam sessions, so join us for that. And then Lucy will be back on Wednesday, November the 8th at 10 o'clock, and she's going to be talking about medications, what you need to know about medication, the benefits and risks for seniors and caregivers. A really important and critical topic, Lucy. Thank you for presenting that. Let's see, do y'all have final words for today?
Just waiting to see if somebody has a comment to make. Okay. So all I can say is take care of yourself. As I always say, there are always 2 or 3 people in a relationship. One does not outweigh the other. So be kind to yourself and do something really nice, something special, whether it's to go for a walk, nice hot bath, go and meet a friend for a cup of coffee. Take care of yourselves.
How could I top that? Brilliant advice and very simple. Thank you.
Absolutely. It's been our pleasure to be with you today, and we hope to see you on our Caregiver Teleconnection sessions in the future. So please plan on being with us, and thank you again for joining us. Bye-bye.
Thank you, Glenda. Thank you, Minerva,
Bye-bye.
for all your help.
Thanks
Bye.
so much. Bye-bye.